Assalamu alaikum. Good afternoon, ladies and gentlemen. My name is Aheed Osman. I'm a consultant sales in spine injuries in Oswestry, and I'm also a senior lecturer at Key University. We're going to present a session in about another 30 minutes, sorry. And it's going to be 3 presentations from eminent speakers. Talking about Sudanese Society of Neuro-rehabilitation. Not only that, but they're going to tell you about a lot of facts which I think all of us need to know about. And we're going to talk about the activities of this group and the challenges for the future. Our first speaker is Mr. Raef Dahab. He's a consultant in Salford Royal Hospital, Manchester. He's specialized in trauma rehabilitation, spinal injury, and neuro-rehabilitation, and too many other things as well. Raef.
Thank you very much, Mr. Aheed. Can you hear me? Assalamu alaikum. Thank you very much for inviting us as a newly established Sudanese Society of Neuro-rehabilitation. And personally, it's a pleasure for me to speak in this meeting, which is close to my heart, being a former academic secretary of the SDU nearly 10 years ago now, which is unbelievable. As Mr. Aheed said, I'm Raef Dahab, consultant spinal cord injury rehabilitation medicine at Salford Royal Hospital, which is not too far away from here. I'm a senior lecturer at HL University, and I'm currently the membership secretary of the newly developed Sudanese Society of Neuro-rehabilitation. So my talk will be to tell you the story of how this society has come to life. So I will take you through a short journey chronologically until we get there. So just to put things into context, rehabilitation medicine is a relatively small specialty globally, and particularly in the UK. Probably there are the least number of consultants in rehabilitation medicine per capita in the whole of Europe. Similarly, in Sudan, it's a small specialty. Probably until a few years ago, there were only a handful of consultants practicing rehabilitation medicine, and most of the practice is related to physical medicine rather than neurological rehabilitation. I quoted the JRCPTB, which just gives you a perspective. Rehabilitation medicine is a person-centered holistic medicine that focuses on understanding the nature and cause of any disability arising as a part of illness. There are many subspecialties in rehabilitation medicine. The most developed one in the UK is neurological rehabilitation, which includes spinal cord injury, rehabilitating brain injuries, including major trauma, traumatic brain injuries, and other long-term neurological conditions. So, our story started, like many other beautiful stories in our country, in December 2018, with the start of the revolution. As we all know, there has been a large number and an increasing number of polytrauma injuries, including traumatic brain injuries, traumatic spinal cord injuries, coracoina injuries, plus amputation, musculoskeletal injuries, abdominal, chest injuries. But probably the most disabling of these injuries are the neurological ones, the brain injuries and the spinal injuries and the coracoina syndromes. We have detected since the start of the revolution, which is ongoing, and the count is rising, at least 23 cases of traumatic spinal cord injuries and coracoina syndrome, and more than 136 head injuries and traumatic brain injuries. Now, at the start of the revolution, a group of very dedicated, patriotic Sudanese doctors living in the diaspora came together. I don't count myself, I'm not describing myself, I'm describing the other brilliant colleagues who are in this group, and created this MDT for Sudan group, which is from the very beginning detected all casualties that resulted from the oppression of the revolution, and started to provide advice and guidance to our colleagues in Sudan on how to manage them. And to the utmost credit of the people who organized this group, they recognized very early that neuro-rehabilitation and rehabilitation medicine in general is a very important part into dealing with this group of people. So in the early stage, I have been invited to be involved in this group with my colleague and classmate Wael Ahmed, who's probably well known to a lot of you as well. And since then, in close collaboration with Hadirin Charity and the organizers of the MDT for Sudan group, we have made a large number of consultations for this group of patients. As you can see, the numbers are detailed here, but between December 2018 and now, and it's ongoing, 25 consultations related to 43 patients. The breakdown of these 43 patients are at the bottom of the slide. The majority are spinal injuries cases, some neuro-rehabilitation cases, and some amputee cases. How we provided these consultations? Some of them were telephone consultations in collaboration with our rehabilitation medicine colleagues in Sudan. Physical ward rounds through visiting consultants from the group, and clinics, which are total 26 clinics. Nearly half of the cases seen face-to-face through 4 clinics, and the rest were virtual clinics using the other technologies that we have discovered with the pandemic, Skype and Zoom and WhatsApp video. There were also some home visits to the injured homes, done either through consultant colleagues in Sudan or visiting consultants from here, from the UK. So gradually a number of rehabilitation medicine consultants got involved, got together. We have made our own group, MDT group, sharing cases with ICU consultants in Sudan and other colleagues to coordinate. I'll come to what RMAC and SSNR mean in a minute. So following this, the role evolved, and then some of these injured heroes have been identified to receive specialist rehabilitation abroad. So we had 6 spinal injuries cases who were sent to India, to the Christian Medical Center in Vellore, a world-renowned center for rehabilitation. 2 traumatic brain injury cases and 6 spinal injuries cases were sent to the Aheed Rehabilitation Center in Cairo, and there is 1 case that was sent to Saudi Arabia in Riyadh that was not included in this slide, but there is a case that went to Saudi Arabia. This was all done obviously in close collaboration with Hadirin and the organizers and managers of the MDT group for Sudan. We only provided the clinical advice and coordinated with the clinicians in these centers in India and in Cairo through continuous communication and contact, coordinated the rehabilitation of these heroes in these centers. As probably a natural progress, then, so coming back to October 2019, we've become aware that the SDU UK had an initiative to fund project in Sudan related to the revolution. So we proposed that this could be for a center established in Khartoum to become the first center for neuro-rehabilitation in the Sudan. So my friend Wael Ahmed and myself wrote the initial proposal in October 2019 and presented it to the SDU executive, and that was the kickstart of the December Revolution Center for Neuro-Rehabilitation. Since then, a lot of steps have been taken and progress has been made. I'm not going to go into details on where we are now, but we are close to start some kind of rehabilitation center and then expand, and probably Mr. Aheed can maybe expand on this a little bit later. So we formed what we called Rehabilitation Medicine Advisory Committee. First meeting attended by Mr. Aheed, Mr. Wael Ahmed, Dr. Salwa Ali Ahmed, who's a consultant, an experienced consultant in rehabilitation medicine who practiced both in the UK and Saudi Arabia. And now she's based in the UK, and she will speak a little bit later. Dr. Ahmed Saad is one of our consultants, colleagues from Sudan. And then later on we were joined by Dr. Aheed Osman, one of our colleagues here in the UK who practice in Liverpool. And Dr. Aladdin Malik, who is a consultant rehabilitation medicine in Australia. And Dr. Sati Hassan, who is one of our other consultant colleagues in Sudan. So as a group, we called ourselves Rehabilitation Medicine Advisory Committee. And our role initially was to advise on the development of the December Rehabilitation Center and to conduct the options appraisal to select the location for the center and to oversee its development. We also wanted to create and strengthen our links with our colleagues in Sudan and to participate in teaching and education of our colleagues in Sudan through workshops and other teaching events. They're all further developed by time, various meetings with stakeholders regarding the center, regarding developing the specialty in Sudan. During this time, and obviously we continued our virtual clinics for the injured heroes. And during that time, the rehabilitation medicine became a registered specialty in the Sudan Medical Specialization Board, and the first ever batch of trainees started in Sudan around 2021, I think. So we have been involved or we have been consulted into the curriculum and into participating in putting the teaching program for these trainees. So as the role evolved, towards the end of 2020, we thought that probably we should further evolve and make a society or form a society that's Sudanese Society of Neuro-Rehabilitation. And it is not a UK thing. We intended to make it a global society so colleagues from across the world can join, which is the case now. We conducted our first meeting as an SSNR, Sudanese Society of Neuro-Rehabilitation, in September 21. We wrote the first bylaws in January this year, and the purpose of the society is to assist members to develop their careers, to participate and coordinate efforts towards the common goal of advancing services provided to neurological rehabilitation spinal cord injury patients in our home country, Sudan. So since January 2022, we have formed a steering committee, developed different offices. We have been meeting on a monthly basis. We have expanded the membership, advertised our society, tried to reach our colleagues in the UK and globally. And at the moment we have 22 members in the society and 34 affiliates, which are mostly trainees from Sudan and trainees from other parts. And I have to say we have a large number of trainees in rehabilitation medicine right now in the UK, and the number is expanding, Sudanese trainees. We have established a dedicated bank account, and we have developed a full teaching program with a full schedule to teach the trainees both in the UK and in Sudan, which has been going very well, and this has been run by our academic secretary, Dr. Salwa. So this is where we are right now, that we have evolved from needing to help with the injured heroes in Sudan to becoming an organized group of doctors who wants to take this specialty further in our country and to benefit our trainees. And I will stop here and let Mr. Aheed introduce the next speaker. Thank you.
Thank you very much, Raef, for a nice presentation. Sorry, the time is not enough to talk about a lot of things, but I will leave some questions to the end. I would like to introduce our second speaker, which Mr. Wael Ahmed. He's a consultant surgeon, spinal injury in the National Spinal Cord Injury Center in Aylesbury, Stoke Mandeville Hospital. He's, as Wael said, Raef said that while he was of the people who started looking after injured people from 2018, and he's very dedicated to that work. There's a lot of things being done. If I want to talk to him, it will take a long time, but I will ask him to start his presentation. Thank you, Wael.
Thank you. Good afternoon, conference. Thank you, Mr. Aheed, for introducing me. I'm going to talk today about the incidents, management, and outcomes of December Revolution, victims of spinal cord injury and traumatic brain injury. I'm not going to repeat what Raef has said already, but we already know that there is thousands of polytrauma injuries and hundreds of martyrs and deaths. And the most disabling of these are, of course, traumatic brain injuries due to disorders of consciousness, quadriplegia, and sequelae, as well as traumatic spinal cord injuries due to paralysis of the systems below the level of injury. In terms of the incidence, the total incidence since the start of the December Revolution of traumatic spinal injuries is 23. That's equally divided to 12 after the coup and 11 prior to the coup. Unfortunately, there were 7 deaths since the start of the revolution because of spinal injuries. In terms of traumatic brain injuries, there is more than 136 injuries in total from the start of the revolution, divided into 117 after the military coup and more than 19 before the military coup, and more than 38 deaths. In terms of the management, I'm not going to repeat probably what has been said, but we know that a lot of the funding came from the Sudanese peoples who have been, and most of the patients were injured and managed in private hospitals. Raef already mentioned about the clinics that we have them. I'd like also to add that there was some support for patients for nursing and physiotherapy needs after they were discharged from trauma centers. In terms of the baseline data of the traumatic spinal injuries, I just divided it into before the military coup and after the military coup. The number is evenly distributed. The mean age is pretty much the same, 23 or 24 years old. They were all males. There were no female deaths. There were mostly gunshot injuries, more than 70% gunshot injuries. A few were sort of road traffic accidents and stab wounds. Mostly there were cervical injuries and tetraplegia, probably 60 to 70%, and mostly were severe injuries in terms of spinal cord injury which is complete injuries. That means below the level of injury there was no sensation or movements, including the sacral segments. 6 of them were sent into abroad for specialist rehabilitation prior to the coup and 6 after the coup. In terms of the deaths, there were 5 from spinal injuries after the military coup and 2 before the military coup. I'm just going to talk about some outcomes from the current cohort of injured victims who are now undergoing rehabilitation in Cairo. In terms of the recovery, we can see that at least 4 out of the 6 patients have started to recover. They're walking. They were AIS grade C, which means that functionally they were able sort of to sit and possibly stand. But now, 6 to 8 weeks down the line, they're walking, doing functional walking using a frame or sticks, and 2 of them are still lagging behind. You can see the improvement in the motor score. Out of 50, they improved mostly to 30s, 35, 31, 33 in one case. And you can see here in the goal attainment scale, the 4 patients, which is case 1, case 2, case 4, and case 6, they are all sort of scoring +1 and +2 in standing and walking. I would like to talk more about the victims who sadly died, our martyrs. There are 7 with traumatic spinal injuries. The mean age is 34, which is slightly higher compared to the 23 or 24 of the whole cohort. They were all males. They were all gunshot. There were at least, I would say, 70% of them were cervical injuries, mostly tetraplegics, and all of them were complete injuries. That means below the level of injury there was no sensation or motor movements. So in terms of the number of days following the injury, the range is 4 to 72, but the average is around 31 days. That means these martyrs had on average around 1 month, where actually the outcome should have been made better in terms of management in ITU and also post-trauma care and post-trauma acute sort of acute rehabilitation services. For that reason, we came up with the idea of the December Revolution Center for Rehabilitation and Traumatic Spinal Cord and Brain Injuries, which started around 2 years ago, or more than 2 years ago, in anticipation to the fact that in mass trauma like war zones and actually revolutions, we will have a lot of injuries of brain injuries and traumatic spinal cord injuries, which are most disabling and can cause high morbidity and mortality. We now have already signed MOU with the University of Soviet University Hospital last year, and recently with Stockholm Teaching Hospital to develop a hyperacute unit along with the Federal Ministry of Health. We're going to talk about that later, maybe in the panel discussion. Thank you very much.
Thank you, Wael, for this. I think we move to the next speaker, Dr. Salwa Ali Ahmed. She's a consultant in neuro-rehabilitation, Nottingham University Hospital, and she's a well-known specialist in traumatic brain injury, neuro-rehabilitation. She has a lot of experience. She does a lot of work for these injured people in Sudan, and also is still giving advice and also teaching in the new specialty in Sudan. Salwa, the floor is yours.
Okay, brilliant. Thank you very much for giving our newly born society opportunity to share with you our current challenges and future aspiration. I'm going to first give you a small introduction. I think my colleague Wael already alluded to about hyperacute rehab. Rehab is a journey, is a lengthy process. It starts from hyperacute, acute, through the inpatient, outpatient, and community-based rehab to achieve social reintegration, which is the objective of rehab. So it is a lengthy process, it is very costly. It's also interdependent on other specialties such as gastroenterology, ENT, and hyperacute, just to name the few. In terms of rehab in Sudan, currently we lack an inpatient rehabilitation services. There is outpatient services run by rehab physician and physiotherapists only. There is a lack of other disciplines. And this is mainly musculoskeletal rehabilitation. By the time patients recognize the need for rehab and come to these facilities, they already develop secondary complications like pressure ulcer, joint contraction, etc. I'm going to, at this point, to talk to you about our experience in traumatic brain injury, together with Hadreen Organization and the newly born Sudanese Society for Neuro-rehab. Me personally, I was involved in 5 patients, which I will initially. I saw face-to-face 3 victims in Sudan when I went for a visit, and 2 of them, they went abroad, as being mentioned, to Cairo and Saudi Arabia, and there is one still in Khartoum with prolonged disorder of consciousness. And this is also cared for by Hadreen in their home. We conducted also virtual consultation, as we mentioned earlier. One of them is a 9-year-old child who was hit by a bullet inside his home courtyard, and this has penetrated his brain, resulted in right hemiplegia. Currently, he is receiving rehabilitation in Soviet University Hospital, Amir Karrar Rehabilitation Center. The second one is a 19-year-old man who is, I'm going to share a short case with you just to illustrate the difficulties we're facing in rehab, and which we have to brace ourselves for it as well. This young man was shot on the 17th of November last year, and the bullet gone through his occipital region and went into his brain, resulted in hemorrhage, subdural hematoma, obvious skull fractures, and he had the neurosurgical operation on the same day. His initial admission to hospital Glasgow scale was 10, dropped during the course of his hospital treatment to 3, and then picked up again. But sadly, he also developed infection at the site of the neurosurgery, so he had a collection that has to be removed as well. And also a bone fragment was left over, need to be removed. He developed DVT in both upper and lower limb, he developed pressure ulcer, COVID infection, and then discharged on the 31st of January after he had affected himself with a full package, I call it, of Hadreen, and we have to salute Hadreen. What they did, as Dr. Wael mentioned earlier, they provided 3-week physiotherapy, 24-hour nursing care, hospital bed, full treatment and consultation whenever they arise, medication, even they source botulinum toxin from United Arab Emirates when it's needed. And also they cleaned and renovated his room. They installed air conditioning as well as providing the family with generator. This is something we have really to acknowledge. We've done a 14 virtual consultation, myself and Dr. Hanan, for this particular patient as well. And also we've done consultation, about 15 phone consultation with a rehab training, and also 15 phone consultation with Hadreen coordinator in Sudan and the family. So my colleague, Dr. Aheed Osman, she was with me in this journey with this gentleman. This is just to show you the current state of this gentleman. He's quadriplegic, he's blind, obviously because it came through the occipital area, so his cortical cortex is gone. He can't communicate. His pressure ulcer is improved from being 12 times 8 centimeters to 8 times 6, a slow process, but he had a lot of urosepsis during this period. And then was found to have 2 bilateral renal calculi and another calculi. He had a urological treatment as appropriate. He had a suprapubic catheter inserted, and also he had infection of his pec tube, which is full of fungal infection, which is the first thing I see in my life. I'm working in rehab for more than 26 years. I've never seen a pec tube infested with candida like this. However, this has been changed now. Anyway, as I mentioned earlier, Hadreen source for us Botox. He had botulinum toxin injection, but just to increase really the agony for this young man who was brutally really shot by the military, in his bed with the nurse noticed he had some bites, and initially we thought it's traumatic when he went for his suprapubic. But this is happened the next day. He found a rat in his bed, and obviously the rat took part of his fingers, and he was unable obviously to communicate or to move. And not only that, the rat also helped himself to take a drink from the normal saline used for cleaning his wound and for its solution. So it can tell you, even it's not just a question of the facilities, it's the environment and the lack of local authorities, which we all know in Sudan, to deal with these kind of situations. So this is just to tell you there is challenges, obviously, for rehab. It's for all developing countries, rehab is quite challenging. For Sudan, it's more enormous because even some of the developing countries already have kind of rehab in Africa. But the healthcare system in Sudan is down to its knees after all these decades of mismanagement. There is a lot of expertise and resources moved outside the country, so the rehab expertise anyway are scarce everywhere, so there's not existing in Sudan. So there is an enormous amount of education and training we need to conduct. And also the professional awareness, even the doctors in Sudan, they don't see what is the role of rehab doctors, and they mix it with the physiotherapy. And the public awareness as well about rehab, and also cultural issues, especially for traumatic brain injury, if there is mainly cognitive and behavioral. So at the end of the day, I don't want to see doom and gloom, but I can tell you there is a light at the end of the tunnel. There is opportunities, and I think the role demonstrated by Hablin is an enormous real role they did, and gave us a really wonderful opportunity to move towards establishing rehab in Sudan. The Sudan Defense Union, from the early stages of the revolution, they embraced a culture of supporting these facilities besides supporting other rehab, other healthcare facilities in Sudan. And also having a Sudanese society for neuro-rehab abroad, which is going to be a global, together with the reactivating the Sudanese society of rehab in Sudan. This is an enormous opportunity for collaboration and for supporting the development of the service. In addition, as we mentioned, there's a Sudan Medical Specialization Board now has acknowledged that rehab medicine started the training. Already training started last year. And also universities, by now the graduated physiotherapists that is still lacking occupational therapy and speech and language therapy courses in the university, but I believe this is going to be started soon. There is increased number of specialty already my colleagues, Dr. Raef and Dr. Wael mentioned, and also training abroad. We got about 4 or 5 training here in the UK, besides in Australia and other places. So we got an opportunity, we will capitalize on it, and definitely we will move forward. So I just finally thank you for giving our society the opportunity to share his experience with you. Thank you very much.
Thank you, Salwa. I know what you're feeling now, but this one example about what happened. We've been through this in the last 3 years. One thing I just want to mention before going any further, please donate to Happy. These are people who give support to the people in their homes. They send nurses, they send physiotherapists, they admit patients to private hospitals. So my plea, please donate.